I want to share with you a story. It's a love story, but not the one you usually hear. This is about something that is often completely misunderstood, even vilified, and some people think it's dangerous. Maybe you guessed what it is. The love story is about CO2 or carbon dioxide. So in 2009, my life changed when I discovered how we can use our breath as a tool. Almost immediately, it helped me to calm the racing mind I've had for almost my entire life. And I realized this was a tool I had been looking for my entire life. And I realized after studying that the main reason why I got this benefit was because of CO2. It was CO2 that helped me calm down, helped me relax. So after a few months after this discovery that changed my life, I decided to take things to the next level. I went out for a jog for about an hour. I had already trained doing nasal breathing only, doing physical activity, so I was used to that. But this time I focused on slowing down my breathing. So I did the nasal breathing, but also slowing down my breathing as much as I could to reduce the outflow of the CO2 produced in our body. I took 2 to 3 steps on the inhale and 5 to 8 steps on the exhale. It was really a big challenge. Every single cell in my body screamed for more air, screamed for me to taking bigger, faster breaths through my mouth, but I stick to it. And the reward, it came when I came home and I sat down at the kitchen table and I felt something I had never ever experienced before. It was such a deep level of relaxation that I would call it a blissful state. 3 hours later, I was still sitting there at the kitchen table, almost thinking, looking around, thinking to myself, where are the angels? And since then, I've done many times what I now call carbon dioxide tolerance training. And the effect is the same every time. Deep level of relaxation, harmony, and inner peace. This story can be yours too. CO₂ therapy, the what, why, and how is the topic of today. So if we start with what is CO₂ therapy? It's about increasing your CO₂ tolerance, which will then improve the oxygen delivery. If we look at the basic breathing physiology, we take in, when we inhale, the oxygen from the atmosphere. The atmospheric air contains about 21% oxygen. But you may be surprised that we only use up very little of that oxygen. We exhale almost 75% of the oxygen we just inhaled. So we use up only about a quarter of the oxygen we inhale. When it comes to carbon dioxide, the atmosphere contains very little carbon dioxide. So usually our inhale is about 0.04%, but the exhale is 100 times more, about 4%. And that is because we are carbon dioxide factories. We produce carbon dioxide in our body. Almost every single cell in our body produces CO2. The key is balance between oxygen and carbon dioxide. Many people in today's society have a tendency to overbreathe, which leads to an imbalance. We have too much oxygen and too little carbon dioxide. And this usually occurs when we are stressed. Everyone can relate to a stressed or worried or anxious person breathing fast through the mouth, shallow, high up in the chest. It also occurs when we are inactive or when we eat junk food. The junk food has usually a low pH, which will affect our breathing because our breathing is the main regulator of the pH in our body. With every single breath, we regulate the pH levels in our body. Overbreathing, we can see that the typical signs are when we're breathing fast, shallow, when we take big breaths, noisy breaths, irregular breaths, labored breaths, when we're breathing through the mouth. All of these types of breathing patterns also leads to overbreathing and an imbalance between oxygen and carbon dioxide. Then you may ask, why is that a problem? Because we need oxygen, right? A car doesn't go better just because we give it more fuel. Your body doesn't run better because we decide to give it 10 liters of water in a day, even though our body consists of 60-70% water. Our body, our car needs the right amount of water and right amount of fuel. And it goes with oxygen as well. We may think that oxygen is our savior. That is the key to everything. And just bring it on. Just take in more oxygen and our problems will be solved. But that is not the case. Oxygen is an extremely reactive molecule. Too much and it will actually become toxic. So if we think about an apple, we take a bite in it and we put it down and we let it sit there for a few minutes and it will start to turn brown. It does so because it's exposed to oxygen. This process that happens in the apple, they also happen in our body. It's the same kind of process. And in our body, when we call it oxidative stress, oxygen-free radicals, they are formed when there is oxidative stress. And that leads to higher levels of inflammations. And across the line, every single disease known to man, we have seen that there are higher levels of inflammations in our body. So we should really be careful with oxygen. It's not only a lifesaver, it's about balance. The other side of the coin is carbon dioxide. And if we want to push it a little bit, we can say that oxygen is basically useless without CO2. Because CO2 regulates breathing. That's our number one bodily function. If we stop breathing, we die within minutes. And it's not lack of oxygen in our body that makes us take the next breath. It is the production of CO2 in our body that stimulates our breathing center in our brainstem to take the next breath. CO2 is regulating our most important bodily function. Basically, it is CO2 that invites the oxygen into the body by stimulating the next breath. Then CO2 helps keep the airways open. CO2 makes sure that the blood vessels are open so that oxygen-rich blood can reach the working muscle or the liver or the brain or wherever it is needed. And also CO2 facilitates oxygen offloading. Oxygen is bound to hemoglobin in the blood. CO2 is a key in order to make the hemoglobin understand that it needs to let go of the oxygen. And that is called the Bohr Effect. It was discovered more than 100 years ago. Finally, when the much needed, wanted oxygen reaches the mitochondria, CO2 has to be there in order to protect the mitochondria from the oxidative stress produced in this process where oxygen extract energy or assists in extracting energy from the food we eat. And that brings us to the topic, why CO₂ therapy? It's all about energy. Just as our home, our car, our factories, they need energy. So does our body. And in our body, we call that energy ATP. Most of that energy is produced in our mitochondria. When we have an efficient oxygenation, meaning we have a balance between oxygen and carbon dioxide, that means we have an efficient energy production. One way of looking at it is we can say a car is highly efficient if it has a high gas mileage. You fill up the car with fuel and then it can go on for a long time. The same with our breath. We can do many things in one breath. If you have inefficient oxygenation, you have inefficient energy production. That translates to fast and shallow breathing, which consumes more of your resources. An example of why oxygen is so needed is if we look at how we convert. We mainly use two sources of food to produce the ATP energy. It's glucose and fat. When we convert glucose to energy without oxygen, we get very little energy, very little ATP. With oxygen, up to 16 times as much. We can extract almost 100% of the available energy in the glucose thanks to oxygen. That's the reason why we die if we stop breathing, that we can't supply enough oxygen to the body, so the body has to convert to produce an energy without oxygen, and that is not enough to sustain life. But we don't stop breathing deliberately, right? But we may have these impaired breathing habits, which upsets the oxygen delivery process. We produce energy less efficiently. So at the end of the day, we end up spending more of our resources on survival and less of our resources on growth and healing and repairing and learning new things, all good things, all the things we want. And secondly, it's not only about the efficient energy production. It's not only about increasing our salary, if you like. It's also about reducing the waste. So when we engage in stress, fear, worry, anxiety, all of these negative emotions, if you like, we consume huge amount of energy, which many of these things we worry about, we don't need to. They never occur. We waste energy by doing that. If we think about the fundamental difference between deep relaxation and stress and panic, those are two completely different states, right? What is the fundamental difference? It's not food, it's not sleep, it's not exercise, it is breathing. When you are in deep relaxation, your breathing is a reflection of that state. It's calm, it's diaphragmatic, it's slow, it's through the nose, it's rhythmic, it's almost invisible. While when you're in a state of stress and panic, then your breathing is a reflection of that state. You're breathing fast, shallow, big breaths through the mouth, irregular, noisy, labored, etc. One example of what happens if we are in a stress and panic state and we come to the hospital, we will get a bag to breathe in and out through. And what does bag breathing do apart from relaxing this panic brain? It increases the CO₂, because we saw earlier you exhale 100 times more CO₂ than you inhale because we produce it in our body. When you exhale that CO₂ into the bag, you will then rebreathe some of that CO₂ on the next inhale, right? So bag breathing is a very quick way of increasing your body's level of CO₂. What you also do is that you decrease oxygen. Basically, bag breathing helps you restore that balance between oxygen and carbon dioxide. If you talk to a flight steward, they say it always works. If we have someone being afraid of flying, we give them a bag to breathe in and out through, and that helps them to calm down. So that in itself is proof of the calming effect that I started off talking, the love story about CO₂, when it helped me calm my brain when I did this 1-hour run. So the next step is then how to do CO₂ therapy. You can reduce the outflow. Nasal breathing is a great way to reduce the outflow of CO₂, to slow down your breathing. You can tape your mouth shut at night. You can use our little device, the relaxator, which gives a resistance on the out breath, and that slows down the breathing. You can become aware of your daily breathing habits. Make sure your mouth is closed as much as possible. So that is the simplest form of CO₂ therapy. You can increase the production of CO2. And the easiest way to do that is doing physical activity, because then our metabolism increases and we increase the production of CO2. You can absorb CO2 through the skin. Maybe if you have seen on our website, we have the cardio suit that you put on and immerse your whole body in CO2. You can also create your own water baths. You can have a soda stream system and carbonate the water by yourself, or you can go to the supermarket and buy carbonated water and put your feet or your hands or even your face in there and then absorb the CO2 through your skin. You can inhale CO2. Maybe you have seen our carbohaler where you inhale a little extra CO2. You can insufflate by adding CO2 to your eyes, ears, rectum, and vagina. You can also do injections, and that's very popular in the beauty industry. It's called carboxy therapy. You inject CO2 to remove scars or miscolored skin. So these are a few examples. CO2 therapy, resources and benefits. We have put a lot of efforts on our website to promote this concept of the benefits of CO2. In our CO2 Academy, we have a lot of articles about different subjects. So nitric oxide is something that is becoming more and more popular. This article here is about why CO2 is needed in order for the body to make nitric oxide. So CO2 stimulates the production of nitric oxide. Another article is about how CO2 helps you reduce pain and increase your levels of vitamin D. How CO2 can rejuvenate your skin. And how you can improve your athletic performance by slowing down your breathing, increasing the CO2 and reducing the oxygen. Here is another example of how you can do a CO2 bath and improve your athletic performance. Even bone healing could benefit from extra CO2. We have huge amount of CO2 in our body. A 70-kilo man has about 120 liters of CO2. And the vast majority of that CO2 is stored in our bones. When we go around in a stressful state, we actually leak CO2 from our bones because we exhale more CO2 than is produced in our bodies. We reduce our reserves, and that could over time have a negative effect on our bone and the bone density. We have a lot of inspiring testimonials, people that have noticed how they can perform better, how they can reduce anxiety, in this case nightmares and severe stress, depression, taking antidepressants. This anesthesiologist from the US has noticed that is highly effective, that the other oxygen therapies he has been working with for 10 years, like hyperbaric oxygen therapy. This woman, Lisa, she experienced a positive effect on her skin issues. This woman, she's a therapist, Anja. She runs a biohacking clinic in Switzerland. She noticed with one client that only one session with the carbohaler where you inhale extra CO2 it was enough to help her client get a big traumatic release. Jonathan Burkhardt, he is a player in Mainz in the German Bundesliga and also in the German national team. He says, after intense training or games, I go into the suit for half an hour and it's almost like I haven't even done the training. I feel almost completely recovered. We have republished some books. This one is called Carbon Dioxide in Medicine. It was published in 1905 by Dr. Achilles Rose. They talk about, in the book, they go through all kinds of different ways of doing CO2 therapy and how it has a very positive effect in ailments like whooping cough, asthma, and anemia, heart and circulation problems, digestive issues, PMS, difficult labor, impotence, and more. It is possible to purchase on our website or on Amazon as well. Here are a couple of images from the book. The first one to the left is from a hospital in Manhattan, New York, from 1895, where they take bats and they fill them up with carbon dioxide. So it's carbon dioxide bats. To the right, you have a boy inhaling extra CO2. We also have in our CO2 Academy more than 400 scientific papers listed. For many of us, it's hard to understand what they mean. What we do is that we take these papers and write articles around them, trying to explain what the studies is about in more layman terms. So here are a few of these studies that we try to explain more. In this study, they inhaled 5% carbon dioxide and showed how it affected the human brain. Inhaling 5% CO2 for 7 minutes increased the blood flow to the brain by 54.5%. CO2 is the main regulator of blood flow to the brain. And that knowledge is used actually in the medical, when a surgeon is doing brain surgery, they put the patients in hyperventilation in order to reduce the blood flow to the brain. When you hyperventilate, you exhale more CO2 than is produced in your body. So you lower the CO2 in your blood and the blood vessels will constrict and you will then deliver less blood to the brain. So the brain will shrink and the surgeon will be happy because there will be more room for him or her to do the job, and there will also be less bleeding. So a shrinking brain, a smaller brain may be an advantage in brain surgery, but not any one of us would want in our daily life, right? So CO2 is the main regulator of the blood flow to the brain. Here we see in this study how CO2 foot bath increases circulation to the feet. This was a 66-year-old woman who was bound to a wheelchair. This is how her foot looked like before the treatment, after 1 month, and after 2 months of daily carbon dioxide baths. 10 minutes each time, 2 times per day, so 20 minutes per day. She put her feet in carbonated enriched water. Broken bones heal faster when exposed to carbon dioxide. In this awful study, they broke the bone on a bunch of mice, and then they had one group that didn't have any treatment, and after 3 weeks, 20% had healed, while in the CO2 group, 90% had healed. You see there, the healing is also a lot better. CO2 bath reduces symptoms in peripheral arterial disease, showing again that it improves circulation. So the symptoms in these subjects in the study, there was almost a 70% reduction in the symptoms. You see the blue bars when they put their feet in carbonated water. So they reduced from 10 to around 3. In the same study, they also saw the blood flow increase dramatically when they put their feet in carbonated water. Also, CO2 regulates nitric oxide production. The production of nitric oxide increases when carbon dioxide levels go up, which we call hypercapnia, and decreases when CO2 levels go down. So this is important, as the nitric oxide is very important to regulate the blood vessels, make them relax. So medication that stimulate the formation of nitric oxide is used, for example, in angina pectoris, when you basically have cramp in your airways. It's also used in Viagra, the sex enhancement drug. Nitric oxide is increased in production when you take Viagra, which will then stimulate the blood filling of the sex organs. CO2 therapy promotes muscle regeneration. After 3 weeks, the muscle area in the CO2 group was 2.5 times larger than the control group, thanks to the accelerated muscle regeneration. Basically, we can say if we have our muscles being in an environment rich in CO2, they will respond by growing stronger and bigger and increase in numbers. In this study, we saw how the formation of new blood vessels and the mitochondria size increased. Here we see the volume of the mitochondria's own DNA. It was 80% bigger than the control group. The mitochondria, they are key, as we started off talking about the energy production. 90% of our energy is produced in the mitochondria, and the mitochondria require oxygen to work, and as we start to see here now in these studies, they also require carbon dioxide to work efficiently. In this study, they saw how CO₂ therapy restored normal lymph flow in all participants. That resulted in a significant reduction in body volume and lymph edema. I don't know exactly what type of scanning they've been using, but this was the baseline, and this was after 10 CO₂ treatments. Huge difference. And every single subject experienced the same positive benefits. Here is another study connected to pain, and EtCO₂ means end tidal CO₂, the amount of CO₂ that is exhaled when we exhale. Below 35 is considered hyperventilation. Normal is considered around 40. Before they started doing breath training, to slow down their breathing, they started become educated about the importance of nasal breathing. In this group, they had 31 tidal CO₂, 31 millimeter of mercury, and the pain was 6.1 on a scale from 1 to 10. After the breath training, I think it was 4 weeks, they had increased their CO₂ levels in their out-breath. They had basically increased their CO₂ tolerance to 37, and the pain was 100% less. To conclude, to summarize the 10 top benefits of CO₂ therapy: stimulates nitric oxide production, regulates blood flow to the brain, stimulates formation of blood vessels, enhances mitochondrial growth, protects against oxidative stress, promotes bone healing, reduces pain, lowers excess inflammatory markers, regulates cholesterol, and regulates vitamin D. So those are the responsibilities of CO₂. Quite profound. As far as we can possibly come from being just a waste product, a villain, something to be afraid of. So in order to help you to increase your CO₂ tolerance, we have developed some products. We have the Relaxator, which gives you a resistance. We have the sleep tape, which is for taping your mouth shut at night. We have the conscious breathing book to help you understand why in the world should I tape my mouth at night, or why is it so important to using my diaphragm. For those who want to learn more, we have the Conscious Breathing Foundation course, and we also have the instructor course. And we have our more recent products, the Carbohaler and the Cardisuit. Carbohaler, where you inhale extra CO₂, and the Cardisuit you put on, and first you vacuum pump out all the air, and then you fill it up with 100% CO₂. And you lay down. Many people experience deep relaxation, even fall asleep. With the Carbohaler, a lot of people report that they increase their mental clarity, they reduce their stress, they have more energy, their airways feel more open. And a lot of them also improve their athletic performance. In my case, which I'm a little proud of, I've been able to improve my push-ups from 49 to 75 since I started the Carbohaler. My baseline, which is because I have a long history with doing push-ups. When I was 13, my record was doing 80 push-ups. My record in 1 month was 25,000 push-ups. So during my whole life, I've always checked in a few times per year or 5-6 times per year or 10 times per year just to check in, where am I at now? So when I was 40, my baseline was about 41 push-ups that I could do out of the blue without any training, just checking in, see how many I could do. When I was 50, it was about 42. Now I'm 56 and my baseline is 55. I've done 3 times this year. I've done 55, 56, and 55. And I attribute that to the carbohydrate. And I think apart from opening up the airways and the blood vessels and make the oxygenation more efficient, I think another reason is because when you inhale extra CO2, you expose the nose is in direct contact with our amygdala, our fear center. So our nervous system is there to protect us always and checking in. This guy want to do push-ups. Let's see how much resources do we have. And before, my nervous system allowed me to do 49. One reason for that is probably because I engaged in what all of us do, more or less. We engage in these unnecessary stressors, these fears, worries, anxious things. So by exposing your amygdala to a little extra CO2, over time you may be able to perceive the world as less stressful. When my nervous system checks in now, it allows me to do more because there are more resources, because I have reduced the waste of that unnecessary energy. If you want to spend that extra energy on doing push-ups, I guess that is fine, but you can also spend it on other things, like learning new things, for example. So we do have a special offer today. If you want to purchase the CardioSuit or the Carbohyler, you will get the foundation course for free. The offer is valid until May 31st, and you just use the code on the checkout. So you put both the CardioSuit or the Carbohyler and the foundation course in your cart, and then at checkout you use the code foundation100, and then the product will be for free. So breathe your way to excellence is our tagline. Change your breath, change your life, keep on breathing.